Hi, I'm Robin,
And I'm Jessica Evett.
and this is our presentation on the Mexican American culture, Hispanic or Latino culture. Um, so we chose to use Mexican American Latinos because it's a pretty prevalent community where we work and in the U.S. Some of the things that we notice with like nursing implications, and ethical considerations when working with this culture is sometimes body contact. Nonverbal is just as important as verbal. Some things that you should be aware of when working with patients from this culture is they tend to avoid eye contact to healthcare providers. So it's not that they're being rude or they don't understand, it's just something that they do. Communication strongly is influenced by respect, which is demonstrated through their family members. So their family members influence their communication. When it comes to standards with healthcare providers, and when you enter the room, they tend to stand up, kind of showing respect to the person coming into the room. They're warm and expressive with their family, and they embrace often. A lot of contact between their family members. Touch by strangers is generally kind of makes them feel a bit uneasy. It's considered to be disrespectful if you don't know them. Handshaking is good and it's polite. It's welcomed. So when you make that first contact, walking into a room or introducing yourself as a healthcare provider, it would be something to consider. Just a nice handshake. They may avoid eye contact. And health issues are sometimes sensitive, and they keep it close-knit. They don't really like to communicate too much with it. Locally, geographically, 17% of the United States population is Mexican American, and that number tends to grow. Primarily, Mexico is one of the biggest geographical locations that most of the population live, but they can be, all over. The United States is the second largest geographical location for Mexican Americans, and Mexico borders the United States on the Gulf of Mexico. Primarily, their language is Spanish. Physical space is important, like we said, except for like close family members, and handshakes are appropriate. So those are some things to remember when you are communicating. If you don't know Spanish, which is, you'd think most of the population here would, but it's kind of hard, having a person on staff or a language line or somewhat an interpreter would be helpful. How they communicate, again, conversation is welcome. Handshakes are important. Trying to have a translator on staff that could, if they don't understand English or don't speak well English or very broken English, it would be good to have a translator. Family is very important to this culture. They have a very strong family foundation. They look to their elders as a source of being grounded. Men in the family are kind of like the ones that make all the decisions. They look to the men in the family. The males in the family carry on the family name and the lineage. So it's important for the men in the family to have that unity with the family. Everyone has a role in the family. The men teach the boys from a young age their responsibilities, and the girls learn from the women. The women kind of tend to run the household, and they do the cooking. The men kind of control everything else. Spiritually, they're very involved with their religion. A lot of their family revolves around rituals, ceremonies, and celebrations. The fathers, again, they take charge of the family decisions. They're the authority figure within the family. Typically, if you think of a Mexican American, a Latino, or Hispanic, you're going to look for darker skin. They can have anywhere from light dark, tan to darker skin colors, dark hair, dark eyes. Obesity tends to be one of their bigger health issues, and with that, they have subsequently higher risks of heart failure, diabetes, cardiovascular disease, things like that. Women tend to have longer hair, longer than the men, and it's usually both thick. They tend to be short in stature. Usually men are about 5'8", women range about 5'4", smaller. Again, common diseases that they face, and especially now more coming over to the United States and even more U.S. type of fattening foods versus the typical foods that they have for their culture. So they see a lot of risks of diabetes, type 2 diabetes, again, cardiovascular disease. Top leading causes of death for them is cancer, heart disease, strokes, diabetes, accidents. Nutrition, this is a lot of their traditional nutrition staples that they have. Corn, beans, squash. They eat avocados, tomatoes. Vegetables play a huge role. Nutrition is a family gathering. They get together. It's a big production. They cook meals. They make rice and beans. This is more of the traditional types of foods that you would see from Mexican American culture. Again, fruits, guavas, prickly pears, some of the things that we probably aren't as familiar with over here. Mangoes is something that we're more familiar with, but these are more of the traditional foods that they tend to eat in their culture. Pregnancy and childbirth, they tend to look to the women in their culture to rear them and guide them. Traditionally, the Hispanic population, women are kind of used to, doing what they're supposed to do and have their family kind of guide them. So they look to the other women in their culture to help get them through their pregnancy and childbirth. They also believe in a hot-cold kind of tradition, so for medical. So they'll kind of incorporate that into their care. Again, here's the hot-cold kind of situation I was talking about. They'll kind of avoid hot foods during their pregnancy because they look at that as a negative thing. And cold kind of relates to, prenatal care. Sometimes they'll avoid that because they're worried about the exam or they're worried about that interfering with the pregnancy. They look at that as a bad thing. And they typically tend to do traditional birthing at home, or they use midwives. They tend to steer clear of medications or pain relief because they see that as, something that you have to do. If you're pregnant, your body kind of gets you through it. And then as you deliver the child, pain control is not something that's going to happen. That's just something that's a rite of passage. It's what you have to do. It's part of being pregnant. It's part of the delivery system. And I'm going to let Jessica finish up some of our PowerPoint.
Death rituals and spirituality in the Mexican culture. Family members tend to look at each other for emotional support and tend to I'll touch on what Robin has talked about, a lot of family involvement, emotional support. Part of the death rituals, the families, they care for the loved ones who are ill and dying, as opposed to looking at professional caregivers. They tend to lean on family more. The majority of Hispanics are Roman Catholics. The church teaches them that the soul is an eternal source, and it continues well after the body has died, expired. A Catholic, on their deathbed, they're given their last rites by a priest. So that's something to keep in mind when you're working in healthcare, to use the priest and then maybe ask if they want that at the bedside. The families, except for pregnant women, they're often significantly involved in caring for a member who is dying. So you'll accept the pregnant women are not involved in this. Public expression with grief is well expected, and I've seen that also in our practice. Once a Hispanic person has passed, they provide a wake. They tend to do more of a burial that's more of a party. They celebrate the death after they've mourned, and they tend to make it a big celebration in their culture. There is high-risk behaviors, as in any culture. Accidents are high. They have a high tolerant. They drink a lot of alcohol, partake in sexual, not using protection, and also drugs, high-rated drugs. As far as their healthcare belief and practices, they use a lot of home remedies, and I've seen this also as my practice. And we try to incorporate that for them. If that's something important to them, then we can also incorporate that using Western medicine and letting them bring in what they would like to do, what's important to them, involving their family. They're very, like Robin said, very concerned with the hot and the cold. So when you're taking care of these patients, we need to ask them, because the hot and cold plays a big part in their health care of how they deal with disease and sickness. they use a lot of prayer. So like I said, Roman Catholics at the bedside, they were really into folk and herbal medicine, and it's okay to incorporate those things, whatever's important to them at the bedside. Using friends' prescription medication is very prevalent in this community, but they are willing to take it from a prescription from a primary care doctor, which they don't tend to seek out as much. When we talk about mental illness in this type of population, it's attributed to imbalances between the person and the environment. They don't see it as the mental illness as we do in the American culture. They see it as some type of an imbalance that can be fixed. Attitudes to our healthcare providers, they appreciate to be spoken respectfully, as anybody does, directly to, and include the family at the bedside. If they have family, we want to bring them in and ask them if they would like to include their family. They don't often seek out for a primary care physician unless they're critically ill. Folk healer, folk healer is sought after more so than a traditional healer. Folk medicine instead of a primary care physician. They use home remedies such as they'll use certain baths, teas. Our physicians need to be attentive, and they need to take their time and show respect. Just because they don't do it the same way we do, we need to consider that. They have Hispanics do have respect for caregivers if they exhibit confidence. As long as you know what you act like you're talking about, you talk to them in a respectful way, they appreciate that. To be culturally competent and to be sensitive, we want to ask the patients, what do you think caused your problem? Let them have the chance to answer the question. You ask the questions, let them come up with answers. What do you fear about your sickness? What's important to you? If you're frequently a provider, you need to learn the language as best as you can. And if you do not want to learn the language, you definitely want to get a translator. If you know the patient Spanish speaking, don't try to talk to them because you can come across as we look like we're, I guess you could say, not stupid, but you want to get a translator. Use eye contact. Get a translator. There's always in a health facility a translator, an iPad of some sort. Include the family, but do not use them as a translator. Health promotion, you can definitely teaching education. You want to incorporate Western medicine as well as the things that they use at home. A plan is very important to these people, this Mexican American. Education and teaching, huge, as it is with any patient that we come in contact. Clear-cut explanations are really important, and definitely with this population, so that they don't seek out medical care, you want to encourage health screenings, which are huge because of the diabetes and the cardiovascular disease. How to show respect, be compassionate, be understanding, basic nursing 101, value their beliefs, be open-minded. And this goes with any culture. Willingness to take your time, explain to them the plan, understanding, ask what's important to them. That's the biggest. And here's our references. Thank you for listening.
Thank you. Hope you enjoyed our presentation.